have anybody on? Okay, one more minute.
Okay.
Or make sure we're, but no, we're at, all right. All right, I'll call this meeting to order. 3:30. We'll right along to item 2, approval of the March 16th minutes. So we have a motion and a second. Any changes? Comments? All right, all in favor of approving the March 16th minutes, say aye.
Aye.
All opposed, say nay. Carries. Now we'll go to item 3, public forum. Anybody here want to say anything to the committee? If anybody on Zoom has anything they'd like to say, you can open up your mic and have at it. Right, we will move on to the financial report then.
All right, so the March financial report, percentage attained should be about 25%. If you look down through the revenues in the first page, we're sitting at about 23.77. So we're revenues we're doing well. Expenditures, first category is labor, and we're running at about 18%. Less than 25 that we would normally have spent at this time of wages, so good.
Run this early?
What's that?
Did you run this a month early?
No. And for the travel category, I know we didn't have much expenditures in the first couple months, but I know we had some conferences and stuff coming up shortly, and those will be hitting in the next couple months. Capital outlay, we just have the one item in there, but I know we are going to be working on the hot water heater project. So that should be coming through shortly. May, June, I think is when we're gonna do the kitchen, the dishwasher. So that will be showing up then. The rest of the other operating category, there's really nothing too big that's outstanding there. I know if you look at the bottom of page 2, the education training, and that's a lot of our Reliance training software package, and the expenditure always comes in the first part of the year. So I don't foresee a whole lot more in that category, in that account. Through the rest, I know the utilities, I see that the power and light is a little bit down, but I know I just got the bill for a cancellation that just came in for March. So the 12% is a little low, but I know there's another 10,000 that just hit for that. I know they're always, you never know when they're going to send the bill through on that. But that's running about normal. Nothing else. Even the professional services, which is our contracted agencies, are in there. It's still at just 14% there. That's pretty much about it for individual items. So the total expenses is at 18%. So we're doing well there. So total overall expenses. We're running a surplus right now of 460,000. We had budgeted for 2.69 million use fund balance, and if we were using that much per month, we would be at about 574 negative. And we're at 465, 460 positive, so we're actually about $1 million better than our budget at this point.
Any questions in the committee?
I just have one, page 3.
Okay.
Equipment repairing.
Yeah.
And year to date is 23,026. Is that several items?
Oh, yeah. Yeah.
And if it is several, can you give me just a couple ideas?
Ooh. Trying to think of. I know we code a lot of our, trying to think of what actually is in that, item. I know we had some refrigerators that need to be repaired. I know that's in part of that number. In the kitchen, so they're fairly expensive.
Which one are you talking about?
Line 54029.
Would there be anything in there, Doug, on like equipment, because of Parkview, anything to do with any lifts or any beds?
That, well, usually a lot of the repair parts are coded in a little bit above that in
Okay,
into the 54017 account,
okay.
but I'm just trying to think of what major item we had in there. I'm not sure, but I can.
If you
I can
do me
bring
a
it back.
favor, just for next meeting,
Sure,
if you would just let me know, I don't want every
yeah,
individual thing,
Yeah.
just what kind of things go in there?
Equipment repairs. Was it the van?
Equipment repair.
no, that's in down farther.
We've got 2 equipment repairs, that's why I asked before, we've got 497 items in that. We've got 2962 for the items in the one above it, and 54029. So,
Yeah, 54029 is when we go out and have somebody else do a repair. The 74029 is when we have somebody from inside
come inside.
inside the county
You know what?
possible.
It was our life safety citations.
Oh,
We had to have electricians come in and put in new electrical equipment in
Oh,
each
yeah.
storage outlet.
probably, yeah.
The fire sprinkler line had to be redone.
Yeah.
Because it wasn't flaccid against the wall. So that was probably those expenses coming up this month.
Yeah, that was a good chunk.
And 54429.
Yes.
Yeah.
Mhm. To repair the life safety citations we got. The survey.
The 74029 is if we would actually have highway do a repair for us. That's where on one of the vehicles possibly.
I see.
Okay. Thanks.
Now, where are you gonna take the boiler repair of the boiler?
That's gonna be on page 2. And that is gonna come about halfway down out of that's in the 54 or 58004 account. If you look at the budget, there's 223,000 in it.
Okay.
That is the water heater, the dishwasher, and there is a new floor scrubber that's in there.
Oh, yeah.
That carried over.
Any other questions?
What kind of issuance did they do when they put the ARPA funds into Parkview? Where did they go, or what did they flush out as far as the percentage or the object numbers as far as loss?
So what they're going to do is In 2022, they're gonna make a transfer in on page 1, about 3/4 of the way down. There's gonna be a 49,501. We're gonna put, looks like 7,677,000 in that account. And then, in either March or April, they will do an expenditure out of, on the 4th page, about halfway down. Other transfers out, 59,501. They'll do the same amount coming out of there.
59,501.
Yep.
Oh, transfer out.
Yep.
Okay, so that's.
Show in there.
That's where they're gonna remove it from.
Yep. I did just see both of those entries just hit just recently. So. The transfer out, and believe it will show up in
Well, yeah.
in April.
Transfer.
But transfer already. Well, it will show up in the final 2022.
Mhm.
Paul gave me Paul Kaiser gave me
There you go.
sheets and whatever that he's been working with. So, yeah. Yeah, he gave me that.
Yeah.
I went through that a little bit, it was just get familiar, that's why I thought I'd ask.
Yeah.
So,
Yeah, really overall, not gonna have any impact because we're just putting money in and then taking the exact same money out. So
yes. Have you discussed it with your audit as far as the people that you're working with as far as the, what is it, ITV or whatever, IT?
oh, the cost, well, the cost report is the one that is what everything is based on.
Yeah.
So, yeah, so our auditor, I actually contacted them.
Yeah, that's good.
We're okay with that.
Anything else about the financial report? Good. All right. Thanks, great news. We'll go on to the administrator's report.
Okay. So for the month of March, census, average daily census was 98. Our occupancy is at about 58%. We had no admissions in the month of March. That was due to a COVID outbreak that started right after this meeting. And also due to staffing, we had 7 total COVID positive residents in that outbreak, 0 deaths. Currently, we don't have any COVID positive cases.
You said 7?
7, correct. No. We had 4 transfers out to the hospital, back to the building. We currently have 26 on the waiting list. Private pay is at 20 for the month of March anyways. Medical assistance is 67. We have family care or managed Medicaid at 7, 0 insurance, 1 Medicare Advantage, 2 Medicare, total residents of 98. Currently in the month of April, you'll see some changes because we have been taking admissions now, after that COVID outbreak just recently ended, in the last couple of weeks. So we have been taking more admissions, and that Medicare and Medicaid number is 3 in March, but I think as of today, we're up to 11. As far as insurance, Medicare Advantage and Medicare, so the premium payers.
Yeah.
So quite a big increase for this month.
Don't you remember something?
11 residents. Correct.
These are the temporary residents, right, that are here for.
Rehab, yeah. short-term rehab.
Right.
Mhm. So for staffing, for March, we had a current number of staff was 67, or I'm sorry, I shouldn't say 67. 164, we hired 8 staff, turnover rate was 3%. We had 2 resignations, 3 terminations. We had a retirement of a CNA, termination of an RN shift supervisor, a CNA, and a hospitality aide. We did have some status changes. An RN went from a 90% to a 10% employee, and a CNA from full-time to 60%, and then also full-time to 80%. So when I say full-time, I mean at 100% status, 40 hours a week.
Determination,
Yeah,
what nowadays is it? The word out there. Absenteeism, is that why they're being terminated?
these 3 specific people, I don't know for certain what specifically their reasons. I know one was for attendance and
That's
performance
the rest of the
issues,
time.
so it's always gonna be either attendance or performance issues for terminations. Mhm.
So I have a question, and it may lead to 3 more, but here, I'll make it as simple and as quick as I can. So if I came out here and I applied for a job, and I told you I wanted to be a CNA,
Mhm.
but I wasn't licensed, would you still look at my resume?
Yeah.
And I could get hired, and you don't have to say yes if this is, so I would come out here, I would give you my resume, you would interview me, and I'd say, I wanna be a CNA, I understand I have to be trained, I have to be certified. You would take someone that had that kind of ambition, and if they met, I don't know, if they met your qualifications, which if they're a warm body and they're really interested, and they would start that position, what would be the first things that would happen? Some training of how Parkview operates with their CNAs, or do you swing them right into the training to get them certified? How does that?
We would have you start out as a hospitality aide.
You would start out at hospitality.
Yes, so you'd be on the floor, you'd be doing supportive work for the CNAs.
How long would you have to be on the floor?
Personally, I would like you on the floor for 30 days,
Oh,
at least,
not months.
at least 30 days. Because that way, that one, you know what you're getting into. Because a lot of people can say, yeah, I want to be CNA, until they know it in details, and then they say, I don't want to do that. We don't
But-
want to send you through the class and pay for your wages to send you through a class for you then to decide, not what I want to do.
Okay, so then the other, so that's a good thing, I understand that.
Hmm.
Now, if I came out here and I was looking for work, and I wasn't sure what I wanted to do, but I wasn't skilled yet. But if I qualified for a hospitality aide, at the end of my 30 days, thinking in my head, I'd come to staff and say, I'm really interested in becoming a CNA. That's allowed also?
Mhm.
Okay,
What's the difference between the CNA pay and the hospitality pay?
I think
The
with
new-
the starting wage, I think it's about $2.30.
Any difference?
Correct.
does a hospitality aide, they qualify for all the health insurance and benefits, right?
Depends on their status.
Okay, explain that.
So you have to be at least a 50% employee to
Right,
qualify for, benefits.
right.
But you could come in and say, I want to be a 30% status employee.
Okay,
You're not gonna get benefits, except for at Parkview, they accrue vacation. But they're not gonna get state retirement, and they're not gonna get health insurance benefits.
so you pick up people that only want to be 30%, because you're changing people of other status here they're going down, somebody at 80 is going down to 60.
Mhm.
Because whatever their life situation or their status, that I wanna stay, but I only wanna work.
Yeah.
Wow. So it would take 3 people to make a full time, if 3 people, to be 30%.
Mhm. Oh, more than 3, we need a 0.1 in there too somewhere.
Do you see that more of a trend? People don't wanna come in and be,
I would say in this area, it's more of a trend than where I've worked previously. Because we have UW Oshkosh that's here, and so we get a lot of students that wanna come. So
and they can't.
they work a lower point status, or you have a lot of high schoolers that wanna come and work. So they take a lower point status.
But you can't, you don't wanna put them through the training coming in as a CNA, if they're gonna stay at a low, a low point status as far as work, the ability to work up into the schedule. How do you determine that their willingness to take the training will in effect get them to work longer, work a fuller shift, we'll say, an 80% or better shift. They have to agree
A lot
to,
of- They can agree to it all they want, but we can't hold them accountable. We can't say if you don't work 80%, then you have to pay us. We can't do that.
or you've got to take them out of the training or whatever. Or they have to go through the training before they get to. this,
Or they can work on the floor if needed, yes. Mhm.
Why can't you do that? Hold them to a higher percentage of work?
Well, we get a lot of students, we have high schooler people that go through the class.
Yeah.
I mean, and some people only wanna work part-time
For various reasons.
for various reasons, yeah.
Then
Go ahead.
that high schooler might like go up today because they're a basketball player and basketball season's over, so they go up in the spring.
Mhm.
In the summer, maybe they go up all the way and then they drop back down because they're getting back into sports or whatever. Is that, I mean, right, you kind of have like people who within, not just like, oh, like I had a kid and so I want to work less, but like just the regular ebb and flow of like a high school or college student's life makes them go up and down in shorter, couple months at a time, right?
Yes, and then you also have, like, we have high school seniors, right, that they're going into nursing school coming up in the fall, so they're gonna be dropping their point status that they're working. They may have been working more hours previously, now they're gonna go to school, they're gonna drop. I think we've got at least 3 that I know that are dropping point status because they've never been to college before, so they're not really sure. So they don't want to be forced to work these shifts if they have schoolwork that needs to get done. So they take a lower status and then pick up shifts.
That's how helpful is that, like having a wider pool of people for picking up?
Well, it's not great for scheduling. It's not great for scheduling because it's not consistent. It's not good for HR either because they're consistently onboarding lower status employees. But we're in a workforce crisis nationwide. So you have to be flexible as an employer these days. You have to be. And if they want to come in and work as a 0.2 status, we're gonna take you as a 0.2 status because that means you're gonna work every other weekend. So then we can start being flexible, possibly with some other people, if they wanna work on Monday through Friday. We might have that flexibility if you have consistent people on the weekends.
And plus, even if you're a 0.2 status, doesn't mean that you can't work 40 hours that week if you want to. You can always pick up extra shifts.
Mhm.
Could I just briefly segue into the housing incentive thing? Please go ahead. Okay. I don't know how much traction that we get right now. Given the fact that we've just had a revised incentive, increased wages, we talked about that in the board meeting, where it's $6 million ongoing cost that come with increase the levy because of it, right? So, what if, again, that idea just to open up one or two of the, neighborhoods in the space that's not being utilized in the nursing home for temporary housing while people are training, to try to have a short-term incentive to draw more people into the facility, irrespective of the other ideas of, housing outside of this facility. You mentioned that one of the counties up north is doing that. You said Polk or Burnett, maybe?
I don't
One of those
remember.
counties.
I think it was Grant County.
Maybe Grant, okay. Same area, but would you consider that, or are we allowed to do that, where you could offer that incentive? New trainees at least that would need it?
So we're allowed to do it.
Mhm.
I talked with the people that govern us, or come and survey us, I guess.
Right.
Division of Quality Assurance, I talked to them. It is an option that we could do. We would need to draw up a contract for that.
Mhm.
It would have to be pretty strict,
Sure.
in regards to
What they're allowed to do.
what they're allowed to do, all of
Latitude.
those kind of things.
Right.
Who's coming into that space, because it's still shared with the residents, so at the same time, their priority.
Right.
But it's an option, it's an option.
The ability to attract a foreign workforce, what are your feelings on that right now? Is that a viable option or not?
It is, I had a discussion with Mike Collard and Ethan and Mark from HR, the director, and we think it's a great option. Corporate counsel would just like to add some additional verbiage to that contract, so just waiting on that additional verbiage so we can get that signed and get that moving.
That's good news.
Mhm.
All right, thanks. That's all
Thank you. Anything else in the administrator's report?
I just have a couple other.
Oh, I'm
things,
sorry.
actually. Sorry.
I did.
So I just wanted to give an update on the CNA class. So we've got 4 CNAs currently in the class right now. Our next class will begin in June. We've got 7 participants for that class. And then again, we've got some college kids that are gonna be coming back that are outside of the Oshkosh area. So they'll be coming back to work, which is great. We do have a ribbon cutting ceremony that's coming up, May 11th from 3:30 to 5:30. That's gonna be at the training center with the Oshkosh Chamber of Commerce. So again, that's May 11th, 3:30 to 5. So you're all more than welcome to come. Anyone from the public's welcome to come. We'll have some light appetizers and some beverages. And then the last thing that I have on my report is the dishwasher just a quick dishwasher update. And that's looking at install approximately mid-May.
Question.
Yeah.
I don't know if I wasn't listening, and that could be, how many people passed? What's the status of residencies? The census.
What is our current census?
Yeah.
98.
Okay, did they, how many passed? Usually you have that in there.
Best way.
Oh,
Yeah.
discharges. Oh, how many residents passed away?
Or not?
That's in there. For chief in March.
That's what you meant.
4
Right.
4 deaths. It's in this sheet, it looks like this.
Oh, see, I'm looking at it on there.
Oh, yeah, it looks like this right here, it's right.
Take your wait for it.
Just so you know where we're looking.
Just haven't been able to put them on.
Yeah.
Anything else? All right, then we'll move on to a discussion about the revised incentive resolution 6506/2022. I'll have the administrator kick us off.
So it's just gonna be a discussion, we don't have anything to vote on today. We're working on the math, right, Doug? We're working on the math for this, but the incentive specifically is the incentive resolution that we have right now. Currently, we have incentives for staff that they can pick up for 4 hours for $25. If you work 80% or above, you can get time and a half, and casual and part-time status employees can get time and a half. And then we also have salaried staff that can work on the floor doing hands-on care for $68 an hour. So we are looking at revising it for a couple of reasons. One, there's been a couple times where we've had to ask the executive for us to be able to offer double time to casual status and part-time employees in order for shifts to get covered. So we need to revise that resolution because we can't keep going against it. Two, it's causing issues with our payroll-based journal, which is reported to Centers of Medicare and Medicaid, and that affects our 5-star rating. It's based off of hours worked by RNs, LPNs, CNAs, administrative. What's it? It's been corrected, but it was causing issues with it. And third, I guess there's more than 2 points, but their third point is to speed up the payroll processing. It's a lot of manual work to do time and a half and the double time to figure out and just manual manipulation of the system, which is causing delays in payroll. So for those 3 reasons, we're looking at revising it. We are looking at revising it to potentially just flat rates. So there would be more tables involved potentially, as far as having a specific table for RNs and LPNs, specific table to casual or part-time status employees, a specific table to CNAs, hospitality aides, food service workers. They would have their own, along with a different one for casual status, but they would be flat rates. So for example, you might have $25 for 4 hours. It might be $40 for 6 hours and $50 for 8 hours. So they would just be flat rate incentives. So that's something that we're working on. And when we come up with these, we would like these to be more fiscally responsible for the building, meaning we're hoping that it would save us money than offering the time and a half and double time that we're offering right now.
Who are you, working with the personnel to accommodate your, count and the dollar amounts when, when they got paid and that sort of thing? I know Joan has said, some of these incentive programs are just a bear to, work out with regard to, paying people individually. So each one has their own, light variance or whatever. You've got to go to each person's payroll and make the changes directly for whoever is working. And they do that independently of what you do here, I think.
No, well, when we're doing the payroll, we have to make sure that the hours are correct, and because right now the system, if somebody signs up for an 8 hours of double time, it actually in our timekeeping system, it will show 8 hours of regular time. And we have to move that regular time to a separate area so that they're not getting paid regular time plus the double. So that's what I'm doing, or the payroll person that shortly will be hired, hopefully. And so I have to make sure that that's all correct before we send it down to Joan. And then she will go through it also to look and see if there's anything weird in it also. So it's getting a lot of eyes on it. If it's an actual bonus, so right now we have a bonus time. So you can put in a 1 or 2, depending on, you want to do a $25 payment, put a 2 in for $50. That actually has no problem going through the system. I don't have to do anything with that. But anytime, so one person might have, say, they picked up 7 different incentives. I have to go to each specific day that there's an incentive and move hours to make sure that that's correct. And when you're doing 240 employees, it takes a while. Right. for a 2-week period. So, the incentive part that we're talking about will handle that without a lot of extra work on the front end before it gets down to payroll.
And you're having to do those, that independent sort of figuring before it ever gets to Joan.
Yeah. I have to make sure that, because right now it's calculating, it's adding the double time in along with their regular pay. So say a person works 8 hours, but it's all double time. It's showing for that day that they have 16 hours. And I have to make sure that it only shows 8 hours. So.
Right. So when your payroll is due on Monday at noon, and it's not in at noon,
Because
it starts causing havoc downtown because they're trying to move on to a different department.
we have to, seeing when the payroll ends on Saturday night at midnight, we have just in the morning on Monday to work on that. Get all that straightened out. Or Sunday.
Yeah, you're coming in on
You
Sunday.
need about 6 minions and a good calculator.
Or just a lot of extra time
Yeah.
right now.
They're not here, is the software not able to deal with that?
Right now, that. Yeah, it's not. Just because of how it's set up with the calculation of overtime. Because it has to, it figures overtime, so.
Is it a canned program or can you modify
Yeah,
it?
it's a canned
Or
program, but
can't
But we
modify it?
can modify it, but it's a lot of, so say the person works a double shift on the first day of the week. Well, by the end of the week, even if they maybe have 30 hours, it's calculating that last day as all overtime.
Okay, so it's a canned program, it's not a macro in Excel.
No, it's a canned program, yeah.
And with the company, you have to use a specific programming language to change it, or is it?
No, it's pretty
the user-
pretty easy to figure out, but Peg Rao is the one that actually does the adjustments.
It's gonna take some time to get it fixed.
And then we did fix because of what it was doing is when I moved hours out of overtime. Or regular time, it would show that that person had no direct care hours. So now it's figuring that correctly. But we have fixed that part, so. Now, when I submit it to CMS division for our payroll-based journals, it's now gonna put in the correct hours.
That being operated on a Microsoft computer, or is it operated?
Yeah, it's on, well, it's our desktop computers, yeah.
Desktop.
It's a program that's down in the IT department. on the server, and we just access it.
Put a part-time,
You're not gonna solve it with iPads.
could a part-time employee at Parkview work 2 days? They, of course, would pay somebody like that. And then could they, every week, if you need double time, they would get paid double time
Not part-time,
every time?
not part-time.
Oh, not part-time. Okay.
Part-time can only get time and a half.
Oh, okay, but
You have to be, right now, you have to be a 0.8 or higher,
Okay.
80% or higher.
But
to get
if I'm
double time.
less than that, and I wanna pick up. You know, I
Not
want,
all shifts are incentive shifts,
yeah,
emergency use only.
okay.
Not all shifts are incentive shifts,
Gotcha,
yes.
cause you see where I'm headed.
They
with
don't pick up a shift and automatically get an incentive,
Okay.
that's not how it works.
Okay.
Yeah,
And the alternative to nobody picking up a shift is you pay a contractor significantly more, right?
correct.
this. Mhm.
Mhm.
Okay, so we're expecting next month to have the math worked out and to have a resolution for us to look at. Any other questions from the committee about that? We just wanted to keep it on, even though we didn't have the math ready for it, just to make sure that we had as many chances as we wanted to answer ask questions and get answers. Before it's ready, I guess. Okay. If nothing else, then we can move on to suggested topics for next time. Any items for the committee? Future meeting, oops, I think we forgot to change.
Yep.
Whoops.
May 18th, I
I
think.
cannot believe we're already looking at May, so yeah, I guess that.
Oh, geez.
May 18th, does that work for any conflicts there for folks?
So Thursday.
Is it Thursday?
Third week.
Yep.
Is that cut into your golf game?
George game.
It's got a busy schedule.
Horace, is that cut into your golf? I mean, was
I'll let you know.
All right, great.
What is it?
The 18th.
All right, then item number 9, adjournment.
No.
Back a second, all in favor, say aye.
it?
We are adjourned. Thank you all very much. Sorry.